Sciatica is one of the most commonly used terms when it comes to back pain, but it's also one of the most misunderstood. A lot of people use the word sciatica to describe any pain that travels down the leg. But technically, sciatica refers to irritation of the sciatic nerve. The sciatic nerve is the largest nerve in the body. It runs from the lower back, through the hips, and down into the leg. When this nerve becomes irritated, it can create symptoms like pain traveling down the leg, tingling or pins and needles, numbness, or sometimes weakness. This is what people usually describe as sciatica. One of the most common causes is a disc irritation in the lower back. This can place pressure on or irritate the nerve as it exits the spine. But that's not the only cause. The nerve can also be affected by surrounding structures. Muscles, joints, or general sensitivity in the area can all play a role. This is why not all leg pain is caused by a disc problem.
Another common misconception is that sciatica is always severe. It can be, but it can also be relatively mild and manageable. The symptoms vary depending on how irritated the nerve is. Some people feel a dull ache, others experience sharp, shooting pain. Another important point is that sciatica does not always require aggressive treatment. In many cases, it improves with time and the right approach. The key is understanding what helps and what tends to aggravate it. Prolonged sitting, certain bending movements, or sudden increases in load can sometimes make symptoms worse. On the other hand, gentle movement, walking, and controlled activity often help reduce sensitivity over time. A common mistake is either doing too little or too much. Some people avoid movement completely, which can increase stiffness and sensitivity. Others try to push through aggressively, which can irritate the nerve further. The balance is gradual exposure. Building movement tolerance over time without pushing into significant flare-ups. Another important factor is recovery time. Nerve-related symptoms can take longer to settle compared to general muscle or joint pain. This is normal. It doesn't necessarily mean something is getting worse. In some cases, additional assessment is needed. If there is significant weakness, worsening symptoms, or changes in bladder or bowel function, that requires immediate attention. But for most people, sciatica improves with the right combination of movement, load management, and gradual progression. The key takeaway is simple. Sciatica is not one single condition. It's a description of symptoms caused by nerve irritation. Understanding that helps you approach it in a way that actually supports recovery.